Blood groups and blood transfusion. Blood groups. Blood groups, also known as blood types, are a classification system used to categorize blood based on the presence or absence of certain markers antigens on the surface of red blood cells. The two most important blood group systems are ABO and RH. The ABO blood group system includes 4 types of blood: A, B, AB, and O. These blood types are determined by the presence or absence of antigens A and B on the surface of red blood cells. Blood type A has antigen A, blood type B has antigen B, blood type AB has both antigens, and blood type O has neither antigen. The RH blood group system is based on the presence or absence of an RH antigen on the surface of red blood cells. If the RH antigen is present, the person is RH positive; if it is absent, the person is RH negative. Knowing someone's blood group is important for blood transfusions and organ transplantations, as compatibility between blood groups is necessary to ensure a safe and successful procedure. For example, a person with blood type A can only receive A or O blood, while a person with blood type B can only receive B or O blood. AB blood type is considered the universal recipient because they can receive blood from all blood groups, and O blood type is considered the universal donor because they can donate blood to all blood types. Blood group and antigen in red cells. Blood group is a classification system that categorizes blood based on the presence or absence of certain markers antigens on the surface of red blood cells. The most important blood group systems are ABO and RH. In the ABO system, there are 4 blood types: A, B, AB, and O. These blood types are determined by the presence or absence of antigens A and B on the surface of red blood cells. Blood type A has antigen A, blood type B has antigen B, blood type AB has both antigens, and blood type O has neither. Additionally, individuals can have antibodies against the A or B antigen that they lack on their own red blood cells. In the RH system, the antigen is called the D antigen. If the D antigen is present on the red blood cells, the individual is RH positive; if it is absent, the individual is RH negative. Knowing someone's blood type and RH status is important for blood transfusions and organ transplants, as compatibility between blood groups is necessary to ensure a safe and successful procedure. For example, an individual with blood type A can receive blood from a type A or O donor, but not from a type B or AB donor. Therefore, it is essential to match the blood type and RH factor of donors and recipients to avoid transfusion reactions. Blood transfusion. Blood transfusion is the process of transferring blood or blood products such as platelets, plasma, or red blood cells, from a donor to a recipient who needs it due to surgery, injury, illness, or other medical conditions. The purpose of blood transfusion is to replace blood components that the recipient's body cannot produce or has lost. Blood transfusions are generally safe, but there are some risks associated with them, such as allergic reactions, fever, infections, and transfusion reactions. Transfusion reactions occur when the recipient's immune system recognizes the transfused blood as foreign and attacks it, leading to symptoms such as fever, chills, hives, and in severe cases, kidney failure, or even death. To minimize the risk of transfusion reactions, blood types and RH factors of the donor and recipient are matched before transfusion. Compatibility between blood groups is crucial to ensure a safe and successful transfusion. Additionally, donors are screened for infectious diseases, such as HIV, hepatitis B and C, and West Nile virus, to prevent transmission of these infections to the recipient. Blood transfusions are life-saving in many medical situations, and proper precautions and screening can ensure their safe use. Donor and recipient in blood transfusion. In blood transfusion, a donor is the individual who donates blood or blood products, such as red blood cells, plasma, or platelets. The recipient is the individual who receives the donated blood or blood products. To ensure a safe and successful blood transfusion, it is necessary to match the blood type and RH factor of the donor and recipient. Compatibility between blood groups is crucial, as mismatched blood can lead to a transfusion reaction where the recipient's immune system recognizes the transfused blood as foreign and attacks it. Donors are screened for infectious diseases, such as HIV and hepatitis B and C, and checked for their blood type and RH factor. Before a blood transfusion, the recipient's blood is also tested to determine their blood type and RH factor. Only when a match is found is the blood transfused to the recipient. Blood transfusions can help save lives in situations such as trauma, surgery, or medical conditions that require blood component replacement. Proper matching and screening of donors and recipients are critical to ensuring a safe and effective transfusion. In general, blood group A individuals can donate blood to individuals with blood group A and AB, and receive blood from individuals with blood group A and O. Blood Group B individuals can donate blood to individuals with blood group B and AB, and receive blood from individuals with blood group B and O. Blood group AB individuals can donate blood only to individuals with blood group AB but can receive blood from individuals with any blood group A, B, AB, and O. Blood group O individuals can donate blood to individuals with any blood group A, B, AB, and O, but can receive blood only from individuals with blood group O. However, it is important to note that the exact compatibility rules can vary depending on the specific antigens or antibodies present in a person's blood. For example, individuals with the Rh factor, Rh positive, can receive blood from Rh positive donors but not from Rh negative donors. In any case, it is essential to match the blood type and Rh factor of the donor and recipient before blood transfusion to prevent transfusion reactions. Precautions taken during blood transfusion. Some precautions taken during blood transfusion are: 1. Properly matching the blood type of the donor and the recipient. 2. Ensuring that the blood is screened for infectious diseases such as HIV, hepatitis B and C, and syphilis. 3. Properly identifying the donor and the recipient. 4. Using sterile techniques and equipment during the transfusion process to lower the risk of infection. 5. Monitoring the recipient for any adverse reactions during and after the transfusion. 6. Having emergency equipment and medications on hand in case of a severe reaction. 7. Administering the transfusion by a trained healthcare professional. Rhesus factor. Rhesus factor Rh factor is a type of protein found on the surface of red blood cells. If a person's blood cells contain this protein, they are Rh positive, Rh plus, and if they do not have this protein, they are Rh negative, Rh. The Rh factor is important in pregnancy as an Rh negative mother carrying an Rh positive fetus may develop antibodies that can attack the fetus's red blood cells, leading to hemolytic disease of the newborn. Rh factor is also considered during blood transfusion as Rh plus blood must not be given to an Rh individual to avoid potentially severe reactions like hemolysis and organ damage. If an Rh mother gives birth to an Rh plus child, there is a risk that during delivery, some of the baby's Rh plus blood cells can enter the mother's bloodstream and stimulate the production of Rh antibodies in the mother. In most cases, the first child is not affected, but in subsequent Rh plus pregnancies, the mother's antibodies can cross the placenta and attack the fetus's red blood cells, leading to hemolytic disease of the newborn. This can cause severe anemia, jaundice, brain damage, and in severe cases, fetal or neonatal death. To prevent this, Rh mothers who have given birth to an Rh plus child are given an injection of Rh immunoglobulin, also known as ROGAM, within 72 hours of delivery to prevent the formation of antibodies. Advantages of blood transfusion. Some advantages of blood transfusion are: 1. Increased oxygen delivery. Blood transfusion helps to increase the number of red blood cells in the body, thereby increasing oxygen delivery to the tissues and organs, which is important in many medical conditions like severe anemia, trauma, and surgeries. 2. Improved clotting. Blood transfusion can help to replace clotting factors, which is necessary in certain bleeding disorders, such as hemophilia and liver disease. 3. Replacing lost blood. Blood transfusion can replace lost blood due to injury or surgery, or in cases of blood loss due to underlying medical conditions, restoring normal blood volume and pressure. 4. Treating infections. Blood transfusion can also provide infection-fighting white blood cells and antibodies, which can help to treat severe infections or immunodeficiency disorders. 5. Treating certain cancers. Blood transfusion can also be used as a supportive measure in some cancer treatments, particularly to help alleviate anemia caused by chemotherapy or radiation therapy. Disadvantages of blood transfusion. Some disadvantages of blood transfusion are: 1. Risk of transfusion reactions. Blood transfusion can cause transfusion reactions, such as allergic reactions, hemolytic reactions, and immunological reactions, which can range from mild to life-threatening. 2. Risk of transmission of infectious diseases. Although rigorous screening and testing standards are in place to prevent transmission, there is still a small risk of transmitting infectious diseases, such as HIV, hepatitis B and C, and syphilis through blood transfusion. 3. Limited availability of blood. Blood products are a limited resource, and there can be shortages of certain blood types or products, which can lead to delayed or cancelled medical procedures. 4. Short lifespan of transfused blood. Transfused blood has a limited lifespan, and it must be used promptly before it expires. The shelf life ranges from 35 to 42 days for red blood cells. 5. Increased risk of complications in certain patients. Blood transfusion may cause complications in certain patients, such as those with heart or lung disease, elderly patients, or those with a history of transfusion reactions. Revision exercise 4.5. 1. What is agglutination? Agglutination is the clumping of particles, such as red blood cells, that occurs when antibodies proteins produced by the immune system bind to their corresponding antigen surface markers on the particles. The binding of antibodies to antigens results in the formation of large aggregates, or clumps, which can be seen visually. Agglutination is an important technique used in blood typing and cross-matching, as well as in the diagnosis of infectious diseases that involve the interaction of pathogens and antibodies. 2. List the precautions taken during blood transfusion. Precautions taken during blood transfusion include 1. Proper donor screening. Donated blood must undergo rigorous screening and testing for infectious diseases, such as HIV, hepatitis B and C, and syphilis, before it can be used in transfusions. 2. ABO-RH blood typing. The recipient's blood type must be determined and matched with the appropriate blood product in order to prevent transfusion reactions. 3. Cross-matching. A small amount of the donor's blood is mixed with the recipient's blood to ensure compatibility before the transfusion. 4. Proper storage and handling. Blood and blood products must be stored and transported at the appropriate temperature, and special precautions must be taken to prevent contamination. 5. Pre-medication. Certain patients may need to receive medication, such as antihistamines or corticosteroids, before the transfusion to prevent or treat possible transfusion reactions. 6. Observation and monitoring. The recipient must be closely monitored during and after the transfusion for signs of adverse reactions, such as fever, rash, shortness of breath, or hypotension. 7. Adequate consent. The recipient or their legal representative must provide adequate informed consent before the transfusion is carried out. 3. Explain why. A. An individual with blood group O is said to be universal donor. B. An individual with blood group AB is said to be a universal recipient. An individual with blood group O is said to be a universal donor because their red blood cells do not express A or B antigens on their surface. These individuals can donate their blood to individuals with any ABO blood type because their blood will not cause an immune reaction, agglutination, due to the absence of A or B antigens. Therefore, their red blood cells will not be recognized as foreign by the recipient's immune system and will not be attacked, making them suitable to be given to any recipient irrespective of their blood group. B. An individual with blood group AB is said to be a universal recipient because they have both A and B antigens on their red blood cells. As a result, individuals with blood group AB can receive blood from any ABO blood type, as their immune system will not recognize the transfused blood as foreign due to the presence of both A and B antigens in their own blood. Hence, blood from individuals with any ABO blood type can be safely transfused to individuals with blood group AB. 4. How can erythroblastosis fetalis be corrected using the modern technology? Erythroblastosis fetalis, also known as hemolytic disease of the newborn, is a condition that occurs when a mother's immune system produces antibodies against her fetus's red blood cell antigens, leading to the destruction of the fetus's red blood cells. In severe cases, it can result in fetal or newborn death. Modern technology offers several methods to correct erythroblastosis fetalis, including 1. Intrauterine transfusions. This procedure involves transfusing compatible blood into the fetus's umbilical vein in utero to replace the destroyed red blood cells and prevent further damage to the fetus. 2. Phototherapy. High-intensity light is used to alter the bilirubin molecules in the newborn's blood, which can help prevent brain damage that can occur due to high levels of bilirubin. 3. Exchange transfusions. This procedure involves removing the newborn's blood and replacing it with compatible blood to reduce the levels of bilirubin and prevent further damage to the baby. 4. Early delivery. In some cases, early delivery before 37 weeks of gestation may be recommended to prevent further damage to the fetus or newborn. It is important to note that erythroblastosis fetalis can be prevented in most cases by administering Rh immune globulin, RhIg, to mothers who are Rh negative during pregnancy and after delivery, which prevents the mother's immune system from producing antibodies against the fetus.